Hi, so it's Dr. Fox, and in this video we're going to talk about managing a BPD episode. And what's important is that BPD episode is when that person is really having what is called a florid reaction. So they're very upset, highly agitated, maybe they're not listening, they're screaming, potentially increasing the probability of self-harm or acting out or anything like that. So I want to quickly give you some tips, some steps that you can do to help manage that BPD episode. First, you got to know that you're relying on your relationship with that person. Ask yourself, are you trusted? Are you patient? Are you caring? Or are you seen as aggressive, neglectful, and uncaring? And that's really important. Doesn't mean that that's what you are, but if that's how you're perceived, that the more negatively you are perceived, the lower the probability that you are going to be able to calm that person down and manage that BPD episode. Now, the first thing that I want you to do is, if you're that person who's seen as trusted, patient, and caring, I want you to get that person to focus on you in the present. A lot of times they're worried about a lot of things that are not directly related to the moment, They're worried about things that might happen in the future or what you're going to do, not what you've done or what you're going to do. You have to get them present focused. Then ask them to breathe with you as you take slow and deep breaths with your stomach, not your chest. See, it's all right. We're going to be fine. Just breathe with me. Breathing is so critical in these situations. And a lot of times these folks are breathing really heavily, really intensely. You want to try to slow that down. Okay, you want to breathe calmly and at an even pace. Also, make sure that you're speaking in a calm voice. Don't be reactive, even if they're calling you names, stuff like that. Don't be reactive, Just be present, try to get them to breathe. Next, you want to reassure them that it's going to be okay, that you're there to help. And hopefully, again, this goes back to that step number one, which is hopefully you're seen as trusted, patient, and caring. That is so critical. Now, once that breathing has calmed a little bit, you want to ask them to explain the triggering incident. If you see that the respiration is rising, go back to breathing and focusing on you, You want to try to get them refocused. Still talk about the triggering event once they're calmed down, not while they're in the middle of that episode, once they're slowly coming out of it, once they're slowly calming down. Now, what you want to do is you want to problem solve the trigger only. Do not stray into larger, more general issues. Stay focused on whatever started or set off that BPD episode. That's so important. Then describe how you're going to help them together, you and that person. What you can do to help, if you can, and that's important. And try to make suggestions that are clear, concrete, and reachable. Also, be sure that whatever you suggest, you follow through on. It is so important. So many relationships with individuals with BPD has to be based on what you say is what you do. Cannot be based on conjecture, cannot be based on hope, cannot be based on aspirations. It is clear. What I say is what I'm going to do. I hope you found these steps helpful. And I wish you all the best, and please take care. Thank you. Bye-bye.